I'm waiting on a countdown.
Okay. I know, I'm looking at the numbers in the waiting room.
Yeah, I saw that too. That was weird, but all right, whatever.
All right, well, hello everybody. My name is Valerie Regan. I work here at Stony Brook in the admissions office. Thank you for joining me today. I'd like to thank my colleagues from admissions who are helping us out today, Jiang, Christopher, and L'Oreal. They'll be answering your questions on chat throughout the session today. If you haven't noticed it yet, there is a chat function and you can click on it and address a question to anybody where it says ask a question and one of us will get back to you. As you know, we are exploring the health professions today, and we will be focusing on 3 majors that we have at Stony Brook, specifically our nursing program, our major in the health science, and our social welfare program. We're fortunate to have with us today to discuss these majors, the Assistant Director for Admissions and Recruitment in Stony Brook's Health Science Office of Student Services, Mr. Paul Ray. Paul has a wealth of information to share with you today, and it is my pleasure now to introduce him to you all. Paul, welcome.
Hey guys, I am Paul Ray, Assistant Director in Admissions in the Office of Student Services in the Health Sciences. As a little expanded thing, I do support the schools of medicine, dental medicine, as well as nursing, social welfare, health technology, and management. I also work with a program in MPH. Some of them are graduate, some of them are undergraduate. I'll talk about all of those in a second. Before I begin with anything though, I like to talk about Stony Brook in general. Because if any of you have done your homework, I sent homework to all of you, so I hope you did it because I will be scoring it. The earliest many of you will be actualized in my majors or programs, with some exceptions, and I'll talk about those in a second, is 2 years from now. For the most part, if you're looking at our undergraduate programs, you wouldn't start applying until your sophomore year. If you're looking at any one of my graduate programs, of course, you would not start applying until your senior year of undergraduate. And just so I get this out, and because I know I'll forget later, for our PA program, which is a graduate program, you actually do have to you are required to do a gap year. What is a gap year? You graduate from your undergraduate, and then for a full year, you're expected, well, a little less than a year, 9 months, you'll be expected to do something interesting, meaningful, before you walk in our doors. So if you graduate in 2024, you will not be able to start our program in the PA until summer 2025. And they will not want to hear that you worked at 7-Eleven or you just kind of hung out by the pool for the year, for the 9 months. They want to know what you've done that is unique or interesting, and it doesn't have to be academically based. And I'll talk more about that and leadership roles in a few seconds. The exceptions to the 2-year rule is we have some honors programs that if accepted into them, you cannot apply to them. But if you're accepted into them, you will be offered a freshman spot where you will have specialized academic advising for those 2 years. And if you do everything you're supposed to be doing, you will just slide right into the program in your junior year. The nursing program has an honors program. Again, you have to be invited. For both respiratory care and clinical laboratory sciences, you can declare them as an undergraduate major. And again, you will get specialized academic advising for those 2 years. And if you do everything you're supposed to be doing, you will not have to apply to those programs. And finally, we have the health science major. This is a 4-year program. You never have to apply to the health science major once you've declared it as their freshman year, as long as you want to stay in it. And I'll talk about the health science major too in a little bit because they're a little different. So before I talk about my majors and how to apply and all that fun stuff, I want to talk about Stony Brook. Well, some of you may be thinking, well, if I have to wait 2 years, why am I looking at Stony Brook? Why don't I go to Onondaga or one of our other great SUNY institutions, and I can start from the ground running? And I will share with you that our sciences, our math, our medical is second to none in the university system. So even though you don't have a definitive spot in whatever program you're looking at, you are going to get an excellent foundation. Our faculty know that if you take Bio 101 with us, or A&P, that's Anatomy and Physiology, with the 1 credit lab with us, they know that you are going to be prepared to further your education in those types of sciences or maths. That is not, and again, all our institutions are great, but this is what we're known for. We are known for our sciences. We are known for our STEM. We are really bar second to none in the university system, and quite frankly, the private system as well in New York State. So, like I said, even though you don't have a definitive spot, your academics will show that you are prepared. And it's not just when people are reading your application and they say, oh, wow, he or she did X, Y, Z, they're fantastic. You're going to have the confidence to apply and know for a fact that you know your stuff. As long as you did the work. I mean, you can't skate by with a D, duh, D. But, as long as you do well academically, you're going to have the confidence to know that you can tackle whatever difficulty you're going to come up against. Because make no mistake, every single one of the programs I'm going to be talking about is highly competitive, and you're going to be up against a lot of great people. So just so that you're aware. Besides the academics, the day-to-day going to class, right across the street, for those of you who live locally, you know what I'm talking about. For those of you who don't, you'll understand very shortly when you come on campus. We live right across the street from one of the top public research hospitals in the United States. We have one of the top research facilities in the United States. What that means for someone even at the undergraduate level is that you get to watch, look, see, research if you want, volunteer in one of the most exciting, innovative places in the United States. And it's right across campus. You don't even have to get into a car to get to the hospital from us. You can walk under Nichols Road. We have a beautiful new tunnel that they've redone. So that is there for you for the taking and to do whatever you want. You can volunteer there formally. You don't have to volunteer there. You can volunteer wherever you want, but you're here already. Why not volunteer there too? One of the other things Stony Brook is known for is undergraduate research. As an undergraduate, we have a very unique outlook on research. Every research institution, of course, does research, but we really do take the time to focus on undergraduate research. We have many formalized opportunities or ways that an undergraduate can do research. It can be as simple as, I'm interested in this, but I don't know how to begin. How do I plug myself in? We have websites. We have faculty members who are willing to say, this is what you can do. This is where you can go. We have research events that students can go to where they can meet and greet, so to speak, some people. You can join clubs. Every single one of my majors has a ... club. What that means is, if you're interested in nursing, you can join the nursing club on West Campus. If you're interested in clinical laboratory sciences, you can join a club. And I won't go through the list, but we have clubs. Also, our faculty and our administrators are very happy to meet with you. Some of our programs, because of the volume of people who have an interest, i.e. nursing, cannot meet with you one-on-one, but they do have information sessions. And as a matter of fact, they will encourage you when you go to these information sessions to bring your transcript so that at the end of their spiel, you can get up and say, I've been to Suffolk for 3 semesters. I'm in my 4th one. How does this transcript look in terms of, did I do the right things? Did I take the right courses? Am I on the right track if I'm looking at 2-year traditional, that kind of thing? And they will do that for you. And they do get very involved in both the clubs and in the information sessions and just generally in talking and presenting at an individual level for 2 reasons. One, they want to make sure you get all the information you need to make the right choice for you. Also, they want to make sure they are identifying talent that will really shine in their program. And there's 2 reasons for that. One is very altruistic. We want the best students who are going to work hard, learn their craft, get licensed, become the best professional they can be, so that they can go out into the world and do good work. We also do that very selfishly. The reason why is because we need young, bright, hardworking students who learn their craft, get their license, to be the best professional that they can be, and do good in the world, because once they do good in the world, that shines well on Stony Brook too. So it does work both ways. I saved the best for last. There's also, I'm sorry, I'm not used to this format, so sometimes I forget things, but we also have specialized programs that are shared by other institutions where students at the undergraduate level can, within the United States, go and share their experiences, do some research outside of Stony Brook and go to other places. One of the most local ones we share with is Brookhaven Lab. For those of you who are local, even those of you who are at a distance, it's an internationally renowned research institution, literally 15 miles from us. So that's a wonderful way to go. Now I've saved the best for last. One of the things, some of our programs, when you apply to them, will require you to do volunteer work. But even if the program does not require you to do volunteer work, I will tell you that it is probably the quickest, the best way to figure out if, oh yes, I had this in my mind, I've watched it, now I know this is definitely what I want to do. Or you may be in a volunteer situation for 3 months and say, oh, I thought this was going to be something very different. This is not what I want to do. I often joke with incoming students. I say, all right, who wants to get into a nursing program? And I can see virtually right now, 80% of you have your hands up. And then I say, okay, now who wants to deal with blood and other bodily fluid that is not your own on a daily basis? And I can tell you not nearly as many hands go up. Now, that's not every nurse's reality in their career, profession, what have you. But at some point, there are many clinicians, not just nurses, that will have to deal in a hospital situation, an emergency situation, that will have to deal with that on a daily basis. And sometimes people realize, oh, I do not want to be touching people on a daily basis. So volunteering will give you a very keen sense very quickly. Yes, this is what I want to do, or no, I do not want to do this. But volunteerism also does something else for you. It's a great way of finding out about the lesser known professions that are very, very vital. For instance, with COVID right now, I promised myself I wouldn't say that, but I have to because we have so many respiratory care therapists who are on the front line in the hospitals. They're the ones that deal with your lungs, your heart, anything happening in your trunk. So as many of you know, people are on have been intubated, are being put on breathing machines. Those are respiratory care therapists that are taking care of them, making sure their PO2 level is correct on a daily basis, working with the doctors to make sure everything is going smoothly. This usually is an interactive question. I don't get to ask it because I can't open the chat and talk to you guys at the same time because I can't walk and chew gum at the same time. But one of the greatest professions that out there in my mind is the clinical laboratory scientists, or CLS people. These are people who are clinicians. They spend a lot of time looking through microscopes. What they're doing is they're looking at samples. They're looking at bone samples, blood samples, urine samples, all different types of samples in your body. Now, if someone is very sick, for instance, they have cancer, some other disease that can only be found internally, it's not apparent externally, it's not like a broken bone or something like that. They are looking for those unusual cells. They are trying to find the healthy cells versus the unusual cells. Once they find the unusual cells, they identify them and they bring them to the doctor so the doctor can create their prognosis and course of treatment. Now, for someone who, for instance, maybe who has cancer and it can be very serious, a CLS person can be the very first person on the road to saving your life, but you will never meet them. So it's a perfect job for someone who wants to be a clinician, but really doesn't want that kind of interaction with a patient. Yet they save people's lives on a daily basis, and you will never meet them. And a lot of people don't realize they even exist until they go into a hospital scenario and say, oh, what is that person doing? Oh, I see. Oh, this is their lab. This is what they're doing. So it is a great way of, just exploring. And one of the things that, and parents don't like me to talk about this. So, if they want to go get coffee or something, that's fine. I'll wait. Okay. You guys might have a very clear understanding of what it is you want to do. You guys may just have an interest and aren't sure what you want to do. And you know what? Both answers are correct. Most of you I'm talking to right now are probably 17, 18 years old, and you're going to go through some very, very serious life changes. That doesn't mean your trajectory or your arc is going to change, but oftentimes it does. So isn't it a great way to look and see what the breadth of all that is out there is, so that you can really make an informed choice? There's nothing better than someone saying, I want to be this person. Well, why do you want to be this person? Well, I did this, I watched this, XYZ, did some research. That's perfect. That's great. Okay, you got it. Go for it. Rather than, well, I was kind of told they make good money. That makes everybody in the medical profession shudder, because that's the pain, the work hours is not worth whatever money people think they can make. And finally, even if you stay, say you do want to be a nurse and you get into a nursing school, you become a nurse, that does not mean that you need to be a nurse for the rest of your life. One of the great things about any of the medical professions is that you can move on, move out, do different things. It was a better story when he still worked with us. He's a faculty member somewhere else now, but I knew a faculty member here at Stony Brook who he got his associates as a nurse, and then he got his baccalaureate as a nurse, and then he got his MBA, and then he got his PhD. So he did all those things. And in the lifetime that I knew him at Stony Brook, he still kept his nursing license. He still kept working part-time just to keep his skills sharp. But in his time here, he was a nurse, a faculty member. He was a director of a program. He was the finance director of the School of Social Welfare and the School of Nursing at the same time. So he did a lot of he wore a lot of different hats, and that's true of any profession. People who start out in social work, who may work for an organization, and they have their clients. Sometimes they get their certification to become specialized counselors so that they can counsel people one-on-one. They can have their own practice, or not just but they can also get licensure in drugs and alcohol so that they can specialize in different diseases or different social concerns that are out there and work with those individuals. A lot of people are surprised to hear that social workers work in the private sector too. You might think, well, what are they doing? Who are they counseling? Well, employees get stressed too. So you know, they need someplace safe that they can go to. But also that there are social workers who look at the macro. What I mean by that is they're not looking at the individual necessarily, but they're looking at a population or a cohort. One of the famous studies in the 70s was very interesting. It was when social workers just started entering the private sector workforce. And this person had the idea of just sending out a questionnaire. What are your concerns? What don't you like? What could be better? And the usual things came back. I fear that I might lose my job. I don't feel like I'm being listened to. And meanwhile, the corporate side is worried that they're going to lose experienced people because, you know, it takes a long time to train someone, you know, anywhere from 6 months to 2 years, depending on the task and what you need to do. So they don't want to waste all that time training, just have that person walk out the door. So the common denominator initially, very simplistic, was everything was dank, dark. So they instituted, the corporation, the building instituted brighter lights, brighter furniture, nicer pictures, but you know, the usual stuff. When you walk in, it's inviting, it's nice, and people were very happy for a while. And then, you know, a year down the road, people were unhappy again. So they kind of switched things around. But it seemed like weird. It seemed esoteric. It seemed not esoteric, facile, very basic and on the surface, not very deep. But people got happy again. Well, this went back and forth for a while, and they realized two things. That the employees were very interested in having an ongoing conversation with their employers. That, you know, although the 3-month questionnaire, 6-month questionnaire was nice, what they were really happy about was that someone ongoing was taking an interest in them. Productivity went up, retention went up, and everybody was more or less happy. So rounding back, there's a lot of different things you can do with the professions at hand. Don't get me wrong, if you're a nurse and you want to stay a nurse, some of the happiest people I know in my life have been, wow, she's been a nurse for 40 years and she still loves it. They're going to have to kick her out of the hospital, I think. But so if that's what you want to do and that's where you want to stay, that's cool too. But you can always spread your wings at any given moment, not just 18, not just 22, not just 30. Any point in your life, you can make that change. One of the things about the professions that I like to talk about is flexibility. As I'm sure you know, people don't get sick 9 to 5. It's a 24-hour, 7-day-a-week thing. So, you know, if you want to work traditional days, you can. If you want to work night times, you can. Part-time, yes. Many hospitals institute for their clinicians and professional employees a 36-hour full-time work week. What that means is for 3 days a week, you're working 12-hour days. They're grueling, don't get me wrong, they're not easy, but then you're off for 4 days. And that's wonderful for people who have child care issues, parent care issues, anything else they need to deal with in their life. They have a good chunk of time that they can deal with those and still have a full-time job with benefits and all that good stuff too. Portability. You don't have to stay where you went to school. If you want to work in a rural environment, you can. Suburban, yes. Urban, absolutely. You know, if you dropped a PA in the middle of China and they couldn't speak Chinese, they are immediately useful to where they are. They can immediately help. They can immediately do something to make those people's lives better. I was an English major as an undergrad, and I loved my time. And people get very annoyed because I'm a grammar Nazi. But if you drop me in the middle of China, I think I'd last 3-4 days before I'm dead in the street. Not useful to anybody, can't speak to anyone, just kind of crying in the corner until, you know. But that's not true for medical professions. They can go anywhere and do anything. Which brings me to my most important point for me personally. I can't think of another professions that has such an immediate positive impact on people's lives on a daily basis. I think the things that we do at SBU are wonderful. I think they're great. I think we all have a sharp focus on getting our students in, making sure they are successful, making sure they go out and do things and that do great things. And that doesn't mean just my students or the medical students. I mean all of our students. But I can't hold up my job against someone, a respiratory care therapist who has been putting in 14 hours a day, saving a person's life or several persons' lives every single day. And that patient being appreciative of that. That is wonderful to me. Now, I did talk a little bit about money, and like I said, we all shudder when we hear it makes good money, but the truth is it makes good money. What I mean by that is, and now parents' ears are pricking up, if you're successful in your program and you're about to get your licensure, chances are you have several opportunities before you of where to work. And I don't mean have to takes because you need to get a job. I mean jobs that you want to have because there is such a desperate need for your unique skills. Which also means that generally your entry-level salary is commensurate with moving out of the house. So you benefit everybody. You get to move out immediately, get your own car. For your parents, they get a new room immediately. They don't have to lend you their car. So these are all good things about joining us in the medical profession. But again, the focus, especially for you guys, is take the time to explore. There's a lot out there, not necessarily medical professions. There are other things you might, another great thing about SBU in general is there are huge opportunities, not just for health sciences, but for all other majors and crafts and professions that you'd be hard pressed to find at other institutions, all in one local place. Val, do we have any, because I'm going to switch gears here, do we have any like immediate questions that I could answer so I can drink some water?
Okay, well, there is a particular interest in pediatric nursing, and students want to know if it's its own major, and if not, what do you have to do to become a pediatric nurse?
Okay, that's an excellent question. The way the nursing profession works is you get a baccalaureate as a nurse. You are just a basic nurse. When you go through the program, you will go through residencies, but they're very short term, typically 2 weeks to a month, just so that you get a smattering of what you may be doing. But when you graduate with your baccalaureate, you become a nurse. Now, you may get lucky. I will share with you that pediatric nurse is the #1 area of interest for nurses. So it is a tough area to get into. But you might get lucky at the undergraduate level and find your way on a pediatric ward. But really what I think you're talking about and what you want to do is once you are a nurse and you've done some work, like let's say you put in a year, hospital, medical center, doctor's office, what have you, you'll want to apply to the master's level for pediatric nursing. Once you, if you go through the master's program, you become, and you get that very specific licensure, you become a nurse practitioner, which means that you have specific knowledge in that area, and you'll have more duties, more long-term duties given to you as a pediatric nurse. And that is really the most likely, even if you're lucky enough to get on a pediatric ward as an undergraduate, with a baccalaureate rather, you tend to be moved at the hospital's whim. But if you're a short-term, the acronym is NP, nurse practitioner. If you're a pediatric nurse practitioner, then that's where you're going to be working, and you'll be working long-term. Okay. Ooh, gee whiz. All right. The mechanics of applying to us. Apart from the exceptions that I talked about earlier, you will have to formally apply to our programs. Now, for those of you who applied through a Common App or SUNY app, and then 2 years hence from now, you apply to one of our programs, you will find our application is much more in depth. It is very business oriented in terms of, we ask you a lot more questions, not just academically, but about yourself and your goals and wishes and needs and wants and all that good stuff. So you apply to our program. Now, first and foremost, academics are key. If our minimum GPA is a 3.0, you do not want a minimum GPA of 3.0. The average GPA for nursing, for instance, it hovers around 3.6, 3.6, 3.7, between there. And nothing can take that away. The rest of your application can look stellar, but nothing can take away from the academics. You will be asked not only to provide transcripts, but to delineate your specific coursework, what you got in each of those courses, so that the schools and the programs can figure out if you're academically capable of being successful in the program. They will also be asking you for 3 professional references. For those of you writing this down, do not worry about writing this down. Every single thing I'm talking about is on our website, is on the school's website. And there will be people throughout these 2 years that will be able to talk to you about it if you forgot something. But we'll be looking for 3 professional references. Typically, it's 2 faculty members and 1 employer that we'd be looking for. But that doesn't necessarily have to be the case. It can be 1 faculty member and 2 employers, but really at least 1 faculty member should be one of those. We'd also be looking for any outside activities or research that you've done. The caveat here is people think they have to do research, it looks better. Research only looks better if you're very interested in it. We don't want you doing research because you think it looks good on paper. Because what'll happen in your interview is someone is going to say, oh, I see you did this and this with Dr. X. How are those mutant genes coming? And if you give a lackluster, did someone catch that? Anyone? If you give a lackluster or vague answer, they're going to know that you had no heart in it. They want to know whatever it is you put forth to them, it's something you had a keen interest in and you can talk about vibrantly, because they know, even if it has nothing to do with what you want to go into. Say you did research on trees in the Northwest dying off and how that's affecting clean air throughout the United States. That has nothing to do with nursing or PA or respiratory care. Well, respiratory care may be a little. Clinical laboratory sciences is social welfare. But the fact that you can talk about it with interest and understanding and depth will give them the notion that you are in general a very interested person. One of my colleagues in academic advising has a great phrase. He says, if you show yourself to be interested, you make yourself interesting. And in a world of 3 6s, 3 7s GPA, that could be that edge that you're looking for, but only if you're interested. In terms of activities and organizations, it's the same thing. You don't want to list 20 activities or organizations that you are part of, and every single one that's listed is member. Well, what'd you do here? Well, I showed up. That means nothing to anybody. So it's better if you're interested to be a member of just a couple or just one, but only if it excites you or if it's interesting. Some of the coolest activities I've seen on admissions applications, and by the way, every single application goes through my office. I don't read them because there's something like 5,000, but every single application goes through my office. But anyway, some of the coolest activities that I have seen is people who started their own activity or organization. And it doesn't have, again, it doesn't have to have anything to do with the health professions. I've seen at least one person who realized that she was a dancer. She is a dancer, I should say. She's still with us. She's a dancer. And she noticed that where she's from, their form of dance is very vibrant and wonderful. And it requires a lot of people. It's not, you can dance as a single, but it also looks fantastic when you're working with 10, 20 people. And it wasn't here. So she created it. And she got some students to join because they thought it was cool. And they've done some wonderful things. And she put it on her application, and she was able to talk about how it was great for her. It was a way to make Stony Brook her home. It was a way to show people her culture and show what she was and what she's about. So it doesn't have to be all health centric. It can, again, getting past the academics, because you can't get past them. But once, 3636, if you can show that you're passionate, that you're interested, that you're interesting, that you're going to bring something to the table. Some of our programs like dental medicine, they go to different parts of the world to work on people's teeth that don't have dentists anywhere in the area. That's an interesting thing. That's a program that was created many years ago by the students with the faculty. And you don't get that if you're bringing in dead weight. You're only getting that if someone's very interested in what it is they want to do. So that's, just showing your joy. I'm kind of cringe when I see this recording and I'm like, but it's a great way to show your joy of life. And they know when you're in the interviews and things like that, that whatever you're talking about, as long as you're honest and open, they know you're going to bring that energy to the table. And that can only make a better graduation class leaving our gates. All right, so we've hit more or less the 15-minute mark, and I know a lot of you have questions. And I know everything I talked about was kind of vague, but that's fine, because over the summer, you're going to get to talk to academic advisors during orientation. In your fall semester, once things quiet down, you're going to go visit everybody in academic advising, like Tien, and have discussions about what the next 4 semesters should look like, what questions you may have. You can look at the website, see where the events are, see what time the clubs are meeting, all that good stuff. So you have plenty of time. Do not think you have to do this all in one shot. One of my favorite sayings, and I'm sure it's mine because it's kind of dumb, but I like the saying nonetheless. You know how walkways, when they use the big cement tiles, and you place one, and then 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 you can walk from point A to point B. I find in these kind of situations, or with type A students, most notably my daughter, what those people like to do is take those tiles and stack them, restack them, and then try and punch through them. You can't do that. Don't worry about that. Take that first step, second step, third step, you'll be fine. All right, now on to the questions.
Okay. Mm-hmm. Well, we had somebody who was interested in becoming a midwife. Could you address that? There's programs for that?
Sure. It's exactly the same. Well, it's not exactly the same. I'll talk a little more specific about midwifery, because there is one interesting thing about them that's different from the other NPs. For midwifery, you really will not be working at the baccalaureate level as a midwife. You may observe, you may be part of the scene, but midwifery is very unique. They do have added experience required and needed. And here's the uniquely interesting thing about them. We have had students, so basically you're going to go for your nurse practitioner, you're going to get your baccalaureate, and then you're going to go for your master's in midwifery. So you're going to get an NP in midwifery. One of the unique things about this is we had 1 or 2 years in a row where we could not graduate midwives. And here's why. Because one of the requirements of becoming a midwife is you have to give birth to a certain amount of babies. And for those 1 or 2 years, there were not enough babies being born. So they had done the work, they had done all their didactic or classroom work, their research work. They were just waiting on moms to come in so that they could give birth to babies, so that they could birth them. And once they hit that number, they became midwives. But that's something that is unusually unique to midwifery. But other than that, it's the same way with what I said about pediatrics. You're really going to go through the nurse practitioner path, master's level.
Great. Next question. As a freshman and sophomore on a pre-nursing track, what is expected of students in regards to their academics for those first 2 years?
You should be excellent. Like I said, it's very competitive. As a matter of fact, this is a tough thing for me to say because I want everybody to stay with us at Stony Brook. But if you really want to be a nurse or a PA or a PT or an OT, you're going to want to apply to several schools. And the defining moment for you is going to be, is it more important for me to stay at Stony Brook University, or is it more important for me to be a nurse? Getting back to your original question, it's going to be the same if you're applying from SBU, which you would be, or you're applying from the outside. You have to be academically excellent. Do the best you can in the sciences you take. The one thing I will share with you is do not try and load your sciences in one semester. Do not try and take A&P 1 with a lab and Chem 1 in the same semester necessarily. Those are both tough courses, and even if you only dipped a little from what you normally would have been, why would you want to take that dip? So be academically excellent as best you can from the get-go. Now, don't get me wrong. Everybody has a slip or an unusually difficult course, but we're talking about your overall GPA, and we're talking about your science overall GPA. Nobody's going to be looking at that one course and saying, but you got a C in this one course. If overall you're fine, there's an understanding that sometimes that just happens.
And of course, prerequisites are important, right?
Yes, yes. Did I not mention that? Yes, prerequisites are really, really important. Yes. But your academic advisors will be talking about those in depth for you and to you.
Great. Could you explain the difference between a nurse and a physician assistant?
I don't think anybody can. I'm kidding. Really, it's a different. That's funny. It is. No, it's a very different way of viewing medicine, and it's a very different pathway. There is a lot of overlap in their jobs and their positions. They work with patients extensively. They work with doctors extensively. PA's focus tends to be more on what an MD, a medical doctor, would be looking at. For instance, if you broke your arm, the PA is going to be focused on working on making your arm better, making sure the cast is on, making sure you're doing your strength training and all that good stuff. But they're really going to be here on that arm. A nurse will also work with the arm, but they're also going to make sure that you're feeling okay, that you're not having trouble at home as a result of a broken arm. They're going to be looking at the whole patient and making sure that, because if your brain is not great, your arm might take longer to heal. So they're really looking at the whole person. For those of you who know anything about the medical profession, medical doctors and ODs are osteopathic doctors. They're the same thing. They're the same exact thing. They can do meds. They can specialize in surgery. It's just a different philosophy. Medical doctors try to fix the problem at hand. Excuse me. ODs are looking at the whole patient.
So So another good question, a student wants to know if their high school record would count when they apply to a nursing program.
Not for us. I can't speak to other institutions, but definitely not for us.
Somebody else asked about academic support services available, and the university does have an academic success and tutoring center available to all students. Our English department has a writing center, and if you need help with writing papers for any subject, you can go to them for assistance. Of course, all your professors have office hours, and they're available for extra help as well. So there are a lot of resources for students at the university if they need extra help. All right, we have a student who wants to know about the radiologic technology concentration in the health science degree.
Excellent question, and something that I did overlook. In the health sciences, you're here with us for 4 years, you get your baccalaureate. In your senior year, you have two options. You can stay with a didactic approach, which is a fancy word for just saying classroom. In your fall semester and spring semester, you're taking classroom work and you get your baccalaureate, you go on your merry way. For those who are looking at the clinical aspects for health sciences, in your fall semester of your senior year, you would apply to those. If you're accepted into it in your spring semester, you would take the intro coursework to those clinicals, and you would graduate with your fellow health science majors in the spring, just like everybody else, and get your baccalaureate. But for the following 9, 10, 12 months, depending on the program, you would be in a clinical atmosphere. You would still take some classroom work, but mostly we're talking about clinical hours. For radiologic tech, and all of these are basically the machines that are being used for different types of medications or review. For instance, a radiologic technologist, what they do is they're working with the machines that are looking through your body and seeing, do you have an unusual mass? Do you have, is something weird going on in some aspect of your body? You're not the doctor who is associating what's going on with your body with a prognosis or treatment. You are the person that is making sure they get the best pictures they can get of your body to make the right call. And that sounds simple, but it is absolutely not simple. It requires a high degree of math and specifics and being able to understand complex machines. Anybody who's gone to Zwanger and Pizzeria or anything like that, whether you've gotten an x-ray, whether you've gotten a radiologic report where you know what I'm talking about. You've seen those huge machines that you go through, that kind of thing. And you see them in the background working on 15 different computers on the wall and on the floor. And, you know, it's, so it is an incredible amount of work. But once you get licensure, because you don't get another degree, but you go for licensure if you're successful, there is such a high demand that our own institution, the institution that trains these people like radiologic technologists, radiation therapists, anesthesia technologists, and so on, we don't have enough of any of them. So just like anybody else in the healthcare professions, you can go anywhere and do fine.
Okay, I think we have time for one more question here. For a student who completes the bachelor's degree level program, are there any combined master's or graduate level programs with the undergraduate degrees?
I'm going to go ahead and say no. We've tried. We do have with some of the nursing, but it actually, let me answer it this way, because usually when people ask this question, this is what they mean. Is there any way I can shave time or years or coursework? In that case, no. Even if you got into a BSMS program, it would be just like going to a full-time Bachelor of Science and then going through the full-time Master of Science. There is no sharing of course credits or anything like that for the clinical programs.
Okay. So to wrap up, you have any advice that you would give to a high school student now, some activities or things they can engage in that might help them down the road to get into one of your programs?
For seniors, you can start volunteering if you're coming to us. One of the things that I didn't mention is any volunteer work or research that you want to put forth in an application has to be at the collegiate level. So for instance, if you're a junior in high school right now, like if you're working in a doctor's office or a medical center right now, unfortunately that will not count, but it doesn't hurt to just go out there and see what's what. Even if you're a receptionist at a doctor's office, that's a great job to have. You're making money and you get to see what the doctor is doing and what that their nurses are doing and whoever else is working in there. Just take the time to explore. And although, again, I want everybody to come to our school, this is your time to explore all the colleges you may be interested in. That's what I think you should be focused on. If you have a clear idea about what you want to do a year down the road, there's no reason to harp on that right now. So look at all the other cool stuff now, and then when it's time, go to that.
Okay, great. One last thing, you had mentioned early on some honors programs, I think specific to the physician assistant program. So I just wanted you to go over that quickly again before we end.
Really, it's actually it's for the nursing program. And really what it is someone chooses, I'm going to use an SBU term, an AOI. It's an acronym for area of interest. Someone has applied to us, and one of the questions on the Common App is, hey, what may you be interested in? And you click on nursing. What will happen from there is our nursing faculty will look at your GPA initially, and if they think it's strong enough, they're going to read your whole application. And if they think you might be a good candidate and 2 years down the road mature enough to be in the program, they may offer you a position in there. And like I said, for those 2 years, you get you'd still be on West Campus. You'd still have to do everything you need to do as a West Campus student as well. But if you've done all your prerequisites for nursing and you've maintained the GPA required of you, you will not have to apply to the program. You will just come in as a nursing student. But to be clear, any one of our honors programs, which if they're at the upper level, it doesn't even make sense to talk about them now because things change so rapidly. But the bottom line is you have to be invited. You can't ask to be in it. You have to be invited.
Okay, great. Well, I want to thank Paul for all the great information he gave us today. I know a lot of you had questions and you're going to think of things as you think about this whole workshop. And you can always get in touch with admissions by email at enroll@stonybrook.edu. And we will get back to you with an answer to your questions. Many of you had questions about physical therapy. We do have another of these sessions coming up in August. It's for our School of Health Technology and Management, and they will be addressing questions about physical therapy at that time.
Yep.
So again, thanks, Paul.
No
thank
problem.
all of you for joining us, and have a great night.
You too. Have a wonderful summer, everybody.
Thank you.
All right.